And now, it's my pleasure to begin the introduction of our next honoree this evening, Dr. Robert K. Ross, who's receiving Partners' prestigious Lifetime Achievement Award. That means you've made a good start, sir. So much more to come. As I'm sure you all know, Dr. Ross is President and Chief Executive Officer for the California Endowment, a private, statewide health foundation established in 1996 to address the health needs of Californians. Prior to his appointment in September 2000, he served as Director of Health and Human Services Agency in San Diego County, and before this as Commissioner of Public Health in the city of Philadelphia. Dr. Ross truly is passionately committed to using philanthropic and nonprofit collaboration to broadly promote equity, racial equity, diversity, and inclusion in partnership, real partnership with community. For example, in 2021, he worked with his board of directors to raise $300 million for a first ever social bond for philanthropy in California, designed to invest in systems change and movement building, support of grassroots activists in social justice, a real signature of his. His leadership is bold, sweeping in impact, consistent over all the years, truly one-of-a-kind leader. To tell you more about Dr. Ross and the California Endowment, I'm really pleased to bring Hector de la Torre to the podium. Hector is a co-chair of tonight's dinner and serves as Executive Director of Gasol Foundation US, a national nonprofit dedicated to children's health and wellness. He's a current board member of LA Care Health Plan, a member of the California Air Resources Board, and a trustee at his alma mater and mine, Occidental College in Los Angeles. Yo triumphi, Hector. Hector served in the California State Assembly ably with great impact from 2004 to 2010. When asked about proud legislative accomplishments, he cited expanding access to doctors in underserved communities, consumer protections against retroactive cancellation of health insurance, please, and supporting facilities improvements at children's hospitals. Quite a track record himself. So please join me in welcoming Hector de la Torre to the stage.
I'm here to introduce Dr. Robert K. Ross, but we all know him as Bob. I've called him Bob already a few times from up here. And he started in Philadelphia, but I'm not going to talk about that because we're in California. We're all about California. You can Wikipedia him. So he started in California, in San Diego, as was mentioned. And I think the most powerful thing that I can say about that time is that I've talked to a number of folks from San Diego who worked with him when he was a public health director down there. And he would have meetings, and his board at that time was not as supportive. And he told people who would come to him from the health sector, from environmental justice, et cetera, and he would tell them, make me do it. He would put the onus on them to come and put pressure on him to do the right thing so that he could have cover with his bosses on the Board of Supervisors. So what did he do? He led a successful Medi-Cal managed care model in San Diego County. He led a public-private children's immunization initiative in San Diego County. And he led key reforms in the juvenile justice system in San Diego County. That was before he ever came to the California Endowment. So, what is he focused on at the California Endowment besides this social bond that was just a couple of years ago? social determinants of health before they were a thing. Not just health, which was the mandate of the California Endowment, allegedly. He saw that there were other needs in the community that needed to be fulfilled. So Bob has been the loudest voice and advocate in support of health for all across the state, expanding health coverage for undocumented residents, farm workers, and dreamers while supporting the safety net. He served as a founding board member of Covered California, where California successfully implemented Obamacare, otherwise known as the Affordable Care Act. He was chair of the Los Angeles County Task Force on Alternatives to Incarceration, developing a strategic roadmap for the county to reform the criminal justice system in support of strategies that would reduce incarceration, not taking things just as they were, or as some people would call it, good trouble. He put his home where his mouth is. Hope Village is as part of the Restorative Justice Village concept over by the California Endowment campus. They are slicing off a piece of their property to put in housing and services for the homeless right there, and the formerly incarcerated right there in their backyard. Yes, absolutely. The social bond we heard about, it is the first ever social bond by philanthropy in California. And this systems change that they're going to push and the movement building of grassroots activists are going to change the face of California public policy. It isn't enough to do nickel and dime stuff here and there for philanthropy. He wants the whole thing. He wants the state to move in a direction that will impact everybody's life. And I think he's received a lot of awards, and he actually doesn't do a lot of this, so I think it's very special that he's doing it for Partners in Healthcare. But he did receive the American Public Health Association's highest award for public health 3 years ago. So people around the country are seeing what he is doing here in California, and he's being appropriately recognized. So I mentioned at the beginning, he's very soft-spoken. He has a keen intellect. He gets right to the crux of the matter when you're meeting with him. He knows everybody and is attuned to everything that's going on, whether it's in LA or in Sacramento. And he is strategic in his thinking. So it's not good enough to be smarter. It's not good enough to have some good ideas. You actually have to make them happen. And Bob has been doing that since I've known him, almost 20 years ago. Nobody had to make him do right by patience, by our society, by public health, by equity, by racial justice, by environmental justice, by social justice, and on and on and on. Bob just did it. Ladies and gentlemen, I present to you Bob Ross.
I was once advised that when they give you a Lifetime Achievement Award, it's time for your butt to retire. And retire I will next year. That That Johnny's, you're like you're a badass. Damn, girl. Wow. I felt so humbled and honored to get the award. And then I ran into Tom Prisilak and Howard Kahn here tonight, who are good friends. And I saw they were past awardees, so it must not be that big of a deal. Tom, watch out when they give you the Lifetime Achievement Award, man. They're trying to tell you something. So yeah, this is, as Janice said, this is an institutional recognition for our foundation, a phenomenal board of directors. It's really supportive, pushes me to do the right thing by communities. One of my board members is here, Torre. Thank you, Torre, for being here. And our staff is we're in love with the social determinants of health equity, racial justice, social justice. It runs and courses through our veins. I really appreciate Partners in Care and June Simmons because, June, 20 years ago, we were on the bus of the social determinants of health when it didn't have that many people in the seats. And now I'm just thrilled to see how institutions, many of them are represented here this evening, UCLA and USC. There's hope for LA because the USC folks table, they were cheering for the UCLA person who got the award. Isn't it a new day? Kaiser and Anthem and others, just thank you for what you're doing to immerse your institutions into health equity and the racial justice aspects of community health and community wellness. In 2026, actually about 3 years from now, on the 4th of July, the nation will celebrate its 250th anniversary. And 250 years ago, the founding fathers, and they were all men, who signed that document, Declaration of Independence. They talked about liberty and justice for all. But that for all, in that 1776 document, came with a very big asterisk, did it not? Because my people, my forefathers, my ancestors were enslaved. Native Americans were being genocidally rampaged across the country. Women couldn't participate in the democratic process. But in about 3 years, we'll have an opportunity to revisit what this nation means and what it stands for. And to revisit what is America, who is America, what is an American, and what does for all mean. And the social determinants of health was the portal into health equity. Because health equity means unapologetic, full, complete inclusion. Everybody in, nobody left behind, nobody left out. And if Washington, D.C. and the politics of many of the states across this country won't pave the way for what unapologetic, full, and complete inclusion means, then it's up to us. It's up to you. So thrilled, Janice, to see UCLA named by our gay, lesbian, queer, and trans community as a model for health outreach, that community is under savage, bestial political attack across this country. And in many states, through the healthcare system, legislating health against the freedom of these individuals. When your life expectancy and your health status is determined by your zip code, that is called injustice. That is structural. That is systemic. And it is up to each and every one of us individually in the work that we do day in, day out, and the institutions that we work with to change that. And if the health system in this country needs to show the nation what for all, complete, beloved community inclusion looks like, then so be it. If California needs to show that, then so be it. And the last thing I'll say, and you saw it and heard it in some of the comments in the video from our grantees, the leaders that we fund and support, who do the health work of social justice. The answer to the homelessness problem is not at Rand. It's not at Harvard. It's from the people who are homeless. That's what we've learned. If we've learned anything at the California Endowment in 20 years, it is those that are suffering at the point of injustice had the experiential wisdom to change systems to what they need to be. When Hector mentioned the dreamers in passing in our introduction, after Obamacare passed and the undocumented were left out, remember that? We were approached by undocumented young people, known as dreamers, to invest in their capacity to use a democratic process to bring health care to the undocumented and specifically expand Medi-Cal for undocumented young people. And they won that battle here in California. That battle wasn't won by Bob Ross or even Janice or Tom Prisilak. That was won by those young people who were undocumented themselves, who were not asking for a charitable piece of the pie, but they were offering us the architecture for a new vision of what a for-all health equity system looks like. It can't be a for-all California if they're left out. And they won that battle. And so, if you want to know what health equity means, it means for all, complete, unapologetic inclusion, nobody left out. And number two, the communities we serve, even the most marginalized and distraught and oppressed, that they had the experiential wisdom to show us what for all really looks like. That when we make a grant to an organization that's fighting that fight that you saw in that video, we're not doing that out of sympathy. We're doing that because it has strategic value and it has moral value. And dare I say, it has spiritual value. It's saying to those people that are oppressed, we see you. We see your value. We see your worth. This nation needs you. That's what health equity means. I know you knew all that. Thank you. Good night.